Hello, my name is Karen Hunt. I am a PhD student in the Graduate School of Nursing at the University of Massachusetts, Dartmouth, and I'd like to take this opportunity to present this poster that represents a concept analysis that I had worked on grief in women with infertility and reproductive loss using a modified Walker and Avant methodology. Grief is considered a normal, universal human response to loss. It's interwoven into and experienced by every age group and culture. It's considered an individualized and dynamic process that's deeply impacted by social and cultural norms. This poster explores what is known about the ways in which women with infertility and reproductive loss experience grief. Many women are choosing to delay childbearing, and this increases their risk of pregnancy-related complications, including miscarriage. Also of note are the vast array of medical advances made in the fields of reproductive endocrinology and antenatal care. The current cultural norm in the United States dictates that infertility and early pregnancy loss are not discussed publicly. This practice likely perpetuates the disenfranchised grief that many women endure as they grieve in isolation. Within the field of nursing, seminal work by Jacob in 1993 proposed the following comprehensive definition of grief in efforts to help guide nursing practice. Grief is a normal, dynamic, individualized process which pervades every aspect, so physical, emotional, social, and spiritual, of persons experiencing the loss of a significant other. A more modern view of grief from a nursing perspective describes it as a transformation and even a catalyst for personal change, leading to a reframing of self. One of the important related concepts to grief pertaining to this population is disenfranchised grief. This is the lack of social support to parallel the intensity of the grief experienced. So this lack of validation for what is lost is largely unacknowledged by the woman's social community and medical team, and therefore it's more difficult for a woman to make meaning from the loss and heal. If we look at the concept map a little more closely, we can see grief in the center. To the left, we see the antecedents. These are the things that must occur before grief. So a woman must have a loss or a perceived loss. She must have dreams and hopes and expectations of motherhood, as well as bereavement. These are worsened by ambiguity surrounding the loss, as well as tangible memories of the child that they lost. And then to the right, you see consequences. Consequences of grief very directly are mourning and disappointment, but they lead to either positive or negative coping strategies. So a positive consequence would be healthy coping, a new self-awareness and personal growth, and restitution. However, a negative consequence can result in self-blame and shame, preoccupation with motherhood, and depression. And at the top, you'll see defining attributes. These are characteristics associated with grief that were repeatedly referenced in the literature. So these include individualized, dynamic, pervasive, multidimensional, anger, guilt, deep sadness, loss of control, yearning, and denial. And the variables very much associated with grief are culture and accepted death rituals, as well as social determinants of health. Knowledge surrounding the grief experienced by women with infertility or reproductive loss is still evolving. However, most of the literature suggests many women are enduring prolonged, pervasive, multidimensional, dynamic grief that is generally not validated or socially or by their medical team. Their grief has the potential to leave a negative impact on their self-identity, hopes for motherhood, and even views towards future pregnancies. It is known that grief is largely shaped by culture. American culture generally does not recognize nor support grief from early pregnancy loss in particular. Women with low socioeconomic status are especially vulnerable to pregnancy loss and disenfranchised grief. Nurses have unique opportunities to support grieving women. Practicing nurses can offer support to all grieving women by validating their experiences of loss, while nurse scientists can conduct formal inquiries to better understand this lived human experience and strategies that best mitigate and support women, guided by the feminist empiricism philosophy. Thank you very much for your listening. If you have any further questions or wish to see a list of my references, please email me at khunt@umassd.edu.